What's up, everybody? Welcome back to the channel.
Yeah, you didn't stop it. Well, you did stop.
Because I said the channel and I got confused. This is Grow Old with Us.
Easily confused.
Where we are growing old together. I was like, how do I fix this? Because I was going to say we are Grow Old with Us, but that's not right. This is Grow Old with Us, where we are growing old together. Welcome back to our channel. I'm Cody. This is Josh. Today we're going to react to how Canada's universal healthcare system works. So I'm kind of excited to see this. I like to see how other places handle things differently from us.
In case we got to get out of here.
We have a friend, actually, who lives in Canada, and when it came to, like, the pandemic, they gave their citizens $2,000 a month. I don't know if they still are. He didn't answer me when I asked him. But they gave their citizens $2,000 a month. And it started pretty much...
Right.
Yeah.
As soon as
like, there was no weight
serious,
gain that we had to deal with.
As soon as it became serious, they were on the ball of taking care of their citizens.
So I like to see what other countries do, not just in that sense, but, you know, we react to the U.S. versus UK food wars because it's interesting to see what type of food is there versus what type of food is here and what's allowed. You know, our FDA allows a lot more stuff than other places, regulatory, you know, food places. So I'm excited to see what their universal healthcare system's like because I am one that believes that our healthcare should be free because everybody should be, it should be a basic human right, in my opinion, because I know people who have to choose between getting the medicine to pay for their cancer, paying for the medicine to help with their cancer or their rent because that medicine is over $1,000 and they're a veteran. And so just different stuff like that makes you wonder. And so I would like to check this out and see if I'm misled or if it actually seems like a good idea.
When you hear people talk about healthcare in America, there's one country that seems to get a good amount of attention. It's a single-payer healthcare system, kind of like the Medicare for All plans that some well-known Democrats have been promoting. In fact, the system's unofficial name is also Medicare. It has universal coverage, it has relatively cheaper drug prices than the United States, and it also has reports of long waiting times and endless reams of red tape. You've probably guessed which country we're talking about: Canada. Canada's healthcare system is playing a larger role in America's political discourse as the 2020 presidential elections heat up. Progressives on the left love pointing to Canada as an equitable and efficient healthcare system. Conservatives, on the other hand, use Canada as an example when warning about the dangers of socialized medicine and unchecked bureaucracy. So, how different really is Canada's healthcare system from what's going on in the United States? In 2017, it's estimated that Canada spent around 10.4% of its GDP on healthcare. By comparison, the United States is estimated to have spent about 17.2% of its GDP that year. The OECD estimates that Canada spent around $4,500 USD per person in 2017. In the United States, though, the figure is expected to be at least double that, at $10,000 per person. Out-of-pocket spending is also lower in Canada. On average, Canadians spent around $650 USD per person in 2016. The average for Americans was around $1,100 that year. Canada still spends more than the average of all 36 OECD countries, which comes in around $3,800 per person and 8.8% of GDP. Despite spending less than the United States, Canada's Medicare system ensures citizens have universal coverage for medical needs that are deemed essential, something the U.S. hasn't accomplished. Canada also has comparable or better health outcomes than the U.S., even though it spends less money. But compared to other countries, Canada's healthcare system has room for improvement. Researchers looked at the rate of deaths that could have been prevented with proper access to care across 11 countries. Canada ranked 7th on the list, while America was last. We can see the same trends in infant mortality rates. Canada outperforms the US, but other countries like Sweden and Australia have much lower infant mortality rates than Canada. Canadians also live longer than Americans. Canada's average life expectancy is among the highest of all the countries and is
Look
nearly
at our
4
life
years higher than the
expectancy.
US.
Holy crap.
Additionally,
Yeah, we've done
Canada's
enough
maternal
UK
mortality
versus
rate is
America
almost
food
4
to know
times
why
lower
that
than
is.
that of the United States, and more Americans
Did
die
you
of
see
heart
that
disease
maternal
and stroke than
mortality?
Canadians. So how does Canada manage to spend less money than the United States while having a more effective healthcare system? Canadian Medicare is a publicly funded model with private delivery. The system was established in order to ensure equity among citizens regardless of people's ability to pay. It was also created in order to keep administrative costs low.
There's no private plan can take cognizance of the family's ability to pay. Only a government can levy taxes on that basis.
All Canadians receive their health coverage through Medicare, which is run at the local level by each province under federal supervision.
So basically, the health ministry in the capital in Ottawa determines what procedures are going to be covered, what we're going to pay for it, what pills we're going to cover on our list. These are decisions that are made separately by insurance companies, basically, in the United States.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different healthcare systems and how well they work.
In Canada, everybody has the same treatment. It would drive them nuts if George got better health care than Sam did. That's not acceptable in Canada.
There's some variation on what is covered based on province, but most medically necessary care is covered with no out-of-pocket costs. There are some universal exceptions. Prescription drugs are not considered essential under Medicare. Dental, mental health, and optometry are also not covered unless they are considered medically necessary. Because Medicare does not cover everything, most Canadians also buy private health insurance through their employers to supplement out-of-pocket expenses. They cannot, however, use that private insurance to purchase care that is covered under the government plan.
If there's any treatment or procedure or surgery that the system covers under its rules, then you can't buy it privately. This is because, you know how in America we hate this notion of socialized medicine, whatever it means, that's really bad. In Canada, the bad thing is what they call two-tier medicine. That is, they don't want rich people getting better care than poor people. That would be terrible. That would violate their basic egalitarian values. In America, we kind of take it for granted that a rich kid is going to get better treatment than a poor kid. That's kind of standard. In Canada, that would be taboo. That's a sin.
In 2015, private funding such as household out-of-pocket costs and private insurance spending accounted for about 30% of healthcare spending in Canada. Despite the majority of healthcare being publicly funded, most hospitals and doctors' offices are privately owned and operated. Doctors who own their own private practices are considered contractors who bill the government insurance fund for their services. The government is not their boss.
The doctors are not allowed to practice outside of the system. They can either practice completely in the government Medicare system or completely out of it. And there are very few places in Canada where a doctor can make a living without taking the Medicare patients. And therefore, for most people, it's the only choice.
Despite having universal coverage, the system still has some problems. Wait times are longer in Canada than the United States. In a 2016 survey, 53% of Canadians said they were not able to get an appointment on the same or next day when they were sick or needed attention. The United States performed slightly better at 42%. Out of all of the 11 countries surveyed, Canada performed the worst in that category. 30% of Canadians said they waited 2 months or longer to see a specialist, compared to 6% in the United States.
6%
Nearly
is
1 in
crazy. I
5
wonder when they did
Canadians
this
waited
because
4 months or more
Brett
for elective
needs a
surgery, while only 4%
two different
of
specialists, and
American
they weren't.
respondents said
Neither
the
one of
same.
them weren't
About
available till like
60% of
summer.
Canadians find it difficult
That
to
might be
access
because
medical
of the
care in
pandemic,
evenings,
though.
on weekends, or
Maybe.
during holidays without going to a hospital. These long wait times can lead to the overuse of the emergency room, where half of Canadians said they've waited 2 hours or more to be seen.
It's a good system, but it doesn't work that well in Canada.
I was gonna say there's nothing new
In its
because we
own
wait
home country.
Several hours.
There are
hours
long
here
waiting
too.
lines. You know, there are constant stories about care being denied, or people just had to wait months just to see the doctor. And I believe that's because the Canadians are too cheap about it. They just don't spend enough on healthcare to have a lively system. Some provinces, like Saskatchewan, where this started, have shorter waiting times for both acute and elective treatment than most of the United States. So there are parts of Canada where it works.
So they just spend
Not
more
all
so
medical
they can
care is
get
covered in Canada,
more
which leads
faculty
people
and
to have
more
significant out-of-pocket costs.
facilities.
Medicare does not classify prescription drugs as essential, which means they are not covered for many patients. There are some
That's crazy
social
to me.
programs to help Canadians pay for drugs, but the benefits vary by province. For example,
can you say
Ontario
a
provides
prescription
prescription
isn't
drug coverage
medically
for anyone
necessary
under
if the doctor
24 years
prescribes
old
it?
who does not have private insurance. The province also has a drug program for people 65 and older. Canadian pharmaceutical costs are also not
What
as
if you have
controlled as
diabetes?
other countries. Canada spends approximately the same amount as the UK on pharmaceuticals, despite having only half the population. There are also no out-of-pocket caps on spending. In 2015, Canadians spent around $670 per capita on retail prescription drugs, compared to the United States per capita costs of roughly $1,000. In 2016, 1 in 10 Canadians did not fill a prescription or chose to skip a dose due to cost. This is still significantly better than the United States, where nearly
Yeah,
1 in
medicine's
5 people
expensive.
chose not to buy medication because of cost. Despite the problems, Canadians are proud of their healthcare system, but they do recognize it needs reform. 94% of Canadians surveyed said it was an important source of both personal and collective pride, but nearly 1 in 4 Canadians were concerned about whether they would be able to pay for all of the care they might need if they ever became seriously ill. Despite that concern, 45% of Canadians rated the overall quality of medical care in Canada as excellent or very good, and nearly 3/4 said the same of their personal care in the past year.
The citizens are crazy about it. It's egalitarian. It treats everybody the same. That's the most important societal value in Canada, is treating everybody equally. And the other thing they like about it is they know it's better than the U.S. system. They have better outcomes. They have better recovery rates from disease. They have longer life expectancy, and they pay less. And man, they love being better than the U.S. That's really, that matters to Canadians.
That's funny.
So, I see that there is, different, like, maybe things we didn't know or room for improvement in areas and stuff like that. I didn't realize that there was so many things not covered and that they still needed private insurance on top of it. But I guess in the sense it works the same as our Medicare. It's just harder to get our Medicare. You have to be pregnant and broke, basically, or a kid. But it's still, there's a lot of things that it doesn't cover that your insurance, you would need insurance for, and then it picks up the tab on the rest. I am still a firm believer that there has to be some way to make healthcare more universal in the United States, especially because what?
System won't do it. As long as we have this classism system, they will never ever want it to be that way. Like he said, it's standard that if you have money, you get better. You get better care, you get better education, you get better.
Well, hospitals
safety.
can't turn you away here if you don't have insurance, but they're going to bill you $67,000 for one night.
Yeah, that's what I'm saying. Like, so it's just, it goes against the American way. Like a person, the classism system, it's set in stone here. That's why everyone's always against Medicare for all, because it'd be like, oh, now bum on the street gets the same treatment as
It also keeps
Mr.
you
Porsche driver over
it
here.
keeps you in the rat race. That's something that I've noticed. Personally, one of my main reasons for staying where I'm at job-wise is because it has good insurance. There have been times when I could have quit and stayed home. There have been times when we were making enough money, with our side jobs and his job, that I could have stayed home, but my job has the better insurance.
Need insurance.
And since we don't have an option that is not too high, but still decent, it is what it is.
You get stuck there. That's why a lot of people are at some jobs where they probably wanted to quit like 5 years ago. But they know They got to get prescriptions. They know they got surgeries coming up. They know they have all these different things, and they're not going to be able to get that if they leave.
It's true.
So it's a trap. It's a trap system as well too. It traps people in places and things like that. Because I mean, I think back when I used to carry the insurance mainly, we was always getting stuck with some BS bull insurance that paying out of pocket $3,000 before it even kicked in or some stupid stuff like that. Like, and it was just dumb. And then when we finally got some good insurance, it was like, okay, you gotta stay because
We can't let go of it.
can't let go of that. So yeah, so I mean, like she said, it keeps you in that rat race. It keeps you stuck too in some places.
So even if you do have an entrepreneurship spirit or you have other options, it's hard to take them because
Yeah, you can't go full throttle until you make enough money to buy your own insurance for the full year.
And then from what I've looked into, it's a lot more expensive.
Yeah.
The benefits aren't as good. So
So
that's where we're at crossroads. So tell me your thoughts in the comments. What do you think? Whose insurance and hospital and medical and all that is better? Canada or US? I think probably both have pros and cons, but yeah, if you live in Canada, we love to hear personal experiences. If you live in the United States and you want to give your own personal experiences, please do in the comments. Let us know if there's something you want us to react to or check out. Anything else?
I bet you ain't paying $6,000 for no ambulance in Canada.
Don't get me started. Until next time, we are out.